Do you ever have erections that are harder than others at different times of the day? I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast. Today, we're answering your questions on the Ask Me Anything episode of the podcast. If you want to be able to ask me anything, you can join us at renamalik.supercast.com, where you'll be able to ask me anything, as well as access ad-free and early episodes of the podcast. Now, without further ado, let's get to it.
All right, first question. Is it weird that I get erectile dysfunction at night? I wake up with morning wood. I have sex in the morning as well if my wife is home from work, but sometimes she wants sex at night and I have a harder time getting hard at night. Can ED happen only at night for some men?
Great question. And the reason this is an interesting question is because there's a reason for this. And the reason is hormones. So typically testosterone, which is a major sex hormone in our body, is released in a pulsatile manner. Now, what that means is that testosterone is released highest in the morning, and then throughout the day, it goes steadily down. Now, there's a little bit of pulse going up in the middle of the day, and then it goes down again, and then throughout the night, it replenishes or restores. So at the end of the day, your testosterone is at the lowest amount that you will have. And for some people, that may lead to issues with erections. Now, hormonal causes are not the number one cause of erectile dysfunction. Oftentimes, you can have issues with erections due to a variety of different things. And we've talked about these on this podcast and on this channel before. These include things like vascular dysfunction, so having decreased blood flow to the penis, things like high blood pressure, high cholesterol, diabetes can all affect the blood vessels, leading to issues with blood flow to the penis. Also issues with the nerves. So if you have any problems like neurologic conditions that affect the nerve function going to the penis, that can make it more difficult to get an erection. Also, if you had surgery like a prostatectomy or any other surgery that could affect the nerve function down there. Also, certain medications like antidepressants sometimes, or even high blood pressure medications can make it difficult to get erections as a side effect of the medication. And of course, psychogenic. So if you are stressed or concerned about getting erections or anxious about getting erections, that can also affect the ability to get erections. But in this case, I suspect that the hormones are a large driver because you're able to get really great erections in the morning when your testosterone is at its highest, but later it becomes more difficult. Now, of course, at the end of the day, you're more fatigued. You probably have more things on your mind because you've gone through the day and potentially more stressors have built up. And so that can also make it more difficult to get an erection at nighttime for some people. So hopefully that answers your question.
Very good. All right. Let's check question number 2. My doctor is recommending me to have a prostatectomy. I don't know enough about what a prostate does. I know the surgeon told me a lot that day, but the shock of him saying I need surgery made me draw a blank when I left the office. What is my life going to look like if I get a prostatectomy? I'm assuming I'll be able to pee better, which is what made me see this doctor who diagnosed my prostate cancer. But doesn't the prostate also affect sex? Will I still be able to have normal sex? So he really just wants to know if he's going to have a good sex life after this prostatectomy.
Yes. So prostates, first to start with, what is the prostate and what is the function of the prostate? So the prostate is a gland that sits underneath the bladder around the urethra or the pee tube where urine comes out. So it does have some function, and the function is essentially to make sure that sperm are healthy. And so it creates fluid that then nourishes sperm and also helps it transit through the vaginal canal. Now, the vaginal canal pH is very acidic. And so the prostate fluid makes sure that the sperm can survive that acidic pH and get to the ovaries and eventually make a baby if that is so desired. And so it's an important function. But the unimportant or the more frustrating thing about the prostate is that as you age, it grows in size. And as this person mentioned, you can have difficulty with urination. And that can be things like difficulty emptying your bladder, maybe straining to pee, maybe waiting for your stream to start or having sort of a stop and go stream. Sometimes it can mean waking up a lot at night or having to go very often or urgently, like you can't delay, gotta go, or you're even having leakage. And sometimes that's leakage after you finish urinating. When you have a diagnosis of prostate cancer, you have many options available to you depending on the grade of your cancer. Is it localized to the prostate? And essentially deciding what is the best option for you. Now, just because you have prostate cancer does not mean you need to have surgery. And so I think this is an important thing to understand. It depends on the aggressiveness or grade of your cancer, or what we call a Gleason grade group. And based on that, we make decisions. Can you go through the route of maybe watching it and getting regular biopsies? That's something called active surveillance to see that it's not getting worse. Can you have surgery, or can you have radiation, or can you do nothing at all? And there's also newer options, including things like high intensity focused ultrasound, as well as certain types of cryotherapy that can be used for prostate cancer as well. But oftentimes they are done in the context of a clinical trial. And so if you have a big academic center near you, you may be able to enroll for a clinical trial. Now, if you've talked to your doctor and decided based on your type of cancer, based on how aggressive it is, that surgery is a great option for you, then it goes on to say what happens to your bladder and to your erections. Because I know you're less concerned about the urinary stuff, I just want to go through that simply is one that, if you're having those obstructive urinary symptoms, like gotta go, or you're waiting for your stream to start, or your stream is sort of weak, then removing the prostate can be helpful in those cases. However, because when you remove the prostate, you also remove one of the urethral sphincters. So the sphincter is what holds the urine in, that this can create some incontinence or leakage. And this is different than the kind of leakage like you gotta go, can't make it and a little dribbles out, or you finish peeing and a little dribbles out. This is actually leakage that occurs when you cough, sneeze, lift something heavy, do any sort of activity that increases pressure in your belly. And so this is something that guys obviously have never experienced in their lives and is very distressing for a lot of people. Now, oftentimes this happens for most guys, at least in the first week after surgery, and then progressively gets better. And usually about 85 to 90% of people will be dry after prostatectomy, but that's usually can take up to 12 to 18 months after surgery to get completely dry. Now, how do you get dry? You can do things like Kegel exercises to strengthen the other sphincter that's remaining to help you hold urine in. And if you're still struggling, then you can talk to your urologist about a multitude of different options that may help with that type of leakage. Now, in terms of sexual function, the reason that people develop erectile dysfunction after a prostatectomy is because there's nerves right around the capsule of the prostate or the outside of the prostate that are very important for sexual function. And when those are injured or removed with the prostate, they can lead to erectile dysfunction. Now, it depends on if your surgeon can do a nerve-sparing prostatectomy, which nowadays is very, very common. So unless you have a tumor that is really pushing against the capsule or very, very large or very, very aggressive, most people can get nerve sparing at least one side, or if not both, to help preserve those nerves. Now, if you have a nerve sparing prostatectomy, your rate of having issues with erections goes down. But on average, when you look at people having any sort of prostatectomy and look at their pre-surgical erectile function, usually about 40 to 60% of them will maintain that sexual function after surgery. But that does mean that 40 to 60% of them will have erectile dysfunction. Now, the important thing is if you have surgery and you're very concerned about erectile function, then there are sort of rehabilitation programs that we do after surgery to sort of help you maintain erectile function. So that can be taking a daily dose of tadalafil daily, or even using injections to help maintain erections after surgery. The other thing is you can use a vacuum erection device. Now, vacuum erection devices I've talked about on my YouTube channel, where I talk about how they're used essentially for getting an erection. But in this case, in men who are about to undergo surgery for prostate cancer, there is some data that using these maybe twice a day for 5 minutes or so can help you maintain length. And the reason this is important is because when you have a prostatectomy, there is some degree of loss of length of the penis. And this is because when you remove the prostate, you're also removing part of the urethra or the P-tube, and then you have to sew those ends together. So that then pulls back the penis a little bit. And so men will experience some degree of shortening. And so using that vacuum erection device, even before surgery, can help you you maintain the size of your penis so you don't lose length or lose much less length after surgery. So I hope that answers your question. But again, it's an important discussion to decide with your doctor what is the right option for you. Now, that's surgical risk factors. Radiation has its own risk factors, and these other options also have their own risk factors. So you want to make sure that you really understand all these options and take your time, because prostate cancer is very slow growing for most people. So you can take your time and get second opinions and talk to other doctors before you go ahead with prostatectomy or whatever treatment you decide to have for your prostate cancer.
So nerve sparing seems to be key there to avoid the ED. You know, one of the related questions that we've seen in the past is not just the concern for ED, but people worry about volume loss with prostatectomies. Is there any concern for volume loss in terms of, the ejaculate or when they ejaculate?
Yeah, that's a great question. So when you remove the prostate, we will actually have to cut the vas deferens on both sides. So you will no longer be able to have children. Now, for most men at that age where they get prostate cancer, this is not a major issue, but important for you to know. So one, there'll be no sperm in the ejaculate. And two, a large volume of the prostate, of the fluid that comes out for your ejaculate comes from the prostate and the seminal vesicles, which are what essentially is creating a lot of the fluid. And so once we remove that, you're going to have very minimal ejaculate after prostate removal, if any at all. And so that is a known consequence of a prostatectomy. That doesn't mean that your orgasm will change. You will still be able to achieve orgasm and feel pleasure, but you won't have the same ejaculate volume.
All right, makes sense. Next question is from Marlena. Every time I have sex, I seem to be getting a UTI. I'm in college now and have started having regular sex for the first time in my life. But every time I've had sex since I lost my virginity, I've had a UTI. This most recent time, I thought it was an STD. So I went to the clinic because I want to make sure that I wasn't missing something bigger. But my test came back fine, except the urine was positive for another UTI. So I got antibiotics again. Am I always going to have UTIs with sex?
Yes, great question. So let's start basics. Urinary tract infection is essentially a bacterial infection of the bladder. Typically, it presents with symptoms like burning when you urinate, feeling the urge to go that's stronger, going more often, having pain in the lower, sort of where the bladder is, what we call suprapubic pain, and sometimes fever or pain in the kidneys or the flank or sort of the side of the back. Now, when you have UTIs, the good news is a large majority of the time they are what we call uncomplicated. So they're not going to create a very big infection or make you very sick. They're just going to make you very uncomfortable. And for women, getting a UTI is exceedingly common, and getting recurrent UTIs, or 2 or more in 6 months or 3 or more in a year, is also unfortunately relatively common. Why does this happen? Well, in the case of Marlena, she's having UTIs after sex. Now, this happens very often. And the reason this happens is not because you're getting it from your partner or your partner has some sort of infection. It's because of the actual thrusting motion that occurs during sex. Now, when you look at the urethra, which is the tube that drains pee, in women is significantly shorter than men. This is why women get UTIs more often, because bacteria can go in from the outside world, particularly near the vagina, and go in, and the colon and rectum, and go in through the urethra and back into the bladder. And so because during that motion of sex, it can make that bacteria move a bit more and get into the urethra a bit easier. So what can you do? Now, anyone who's suffering from UTIs can afford to drink more fluids. And the reason for this is when we look at studies of people that have drank more, have added 1.5 liters of fluid to their daily fluid intake, meaning they're drinking almost 1.5 liters more, so a Coke bottle and a half more fluid throughout the day, you're seeing that they actually reduce their UTI rate by 46%. So it is, you're sort of diluting any bacteria that's there, and your body is pretty remarkable. In fact, 46% of people can treat their own UTIs. They just resolve on their own because our bodies are so magnificent that they sort of clear out bacteria on their own all the time. And urine is not sterile. So previously there was some thought that urine is sterile, but now as they've increased investigations in this, which seems to be a pretty easy investigation to do, it's not all sterile. There is always some bacteria in the urine. And so having bacteria is not dangerous unless you're symptomatic. Other things you can do, particularly if you're having them after sex, is one is you can try to make sure that you urinate before sex and sometimes even after. Now, this is not evidence-based. There is no evidence to support that urinating after sex actually prevents UTIs, but I'm sure many of you have heard this, that, your mom may have told you, make sure you urinate after sex. And for some people, it really works. So I tell people, if it helps you, by all means, that's totally fine, but there's no evidence to support it. And so if it's like, hey, I just want to lie around and not get up and urinate, and that's okay too. Now, the other thing is avoiding constipation. So because a lot of the bacteria comes from stool, when you're constipated, that stool is sitting very close to the opening or the anus. And so that can then create more bacteria load that can then get into the urethra. So making sure you're not constipated and treating your constipation can be very helpful. So getting over-the-counter products or talking to your primary care doctor about treating constipation. I also made a video many years ago about a recipe that I give my patients. It's basically applesauce, prune juice, and fiber mixed together. If you want to check that out, I'll put the link in the description. The other thing that you can do is make sure that when you're urinating, you're not rushing. So a lot of times we'll hover over a toilet because we think it's dirty, we don't want to sit on it. And once in a while, of course, that's okay. But if you're doing it all the time, then you are creating some sort of dysfunction in your pelvic floor because your pelvic floor is not relaxing. And this is that bowl of muscles that you sit on when you urinate. When you're urinating, normally it should be relaxed to allow that sphincter to relax and urine to flow out easily. But when it's contracted, you're now pushing against contracted muscles to pee, which makes it more difficult and allows you maybe to empty less well. And then that urine that sits in your bladder becomes food for bacteria. So sometimes I'll tell people to even sit, pee, stand up, sit back down, and pee again. Sometimes that may also mean leaning forward a little bit to make sure that your bladder is completely empty. So that's also very, very important. Now, there is some evidence for women with recurrent urinary tract infections that cranberry supplements or cranberry juice can be helpful. And based on the literature, we see that cranberry supplements with 36 milligrams of proanthocyanidins in a soluble form, meaning that they're coming from the berry itself, not the whole berry, but the inside of the berry. So when people say whole berry products, they're often including the skin and the stems of the product, which are really not helpful. And there's also newer evidence that using cranberry juice itself, the 100% cranberry juice, is also very effective in preventing recurrent UTIs. Now, in someone who's having UTIs solely after sex, you can also talk to your doctor about getting an antibiotic, one dose of antibiotic that you take after sex to prevent from getting a UTI. Now, of course, there are risks with taking antibiotics chronically, so something to talk to your doctor about and decide if that's what's right for you. Now, for a lot of people, it makes their lives a lot easier. They feel secure and safe that they have this ability to do that, and so they're not so stressed about always getting a UTI, particularly when they're traveling or out of the country. And so definitely something to discuss with your doctor. Now, the last thing I want to point out is that this is not because you're doing something wrong. So this is not because you are unhygienic or not clean. I think a lot of people get told when they have recurrent UTIs that they're not wiping correctly, wipe front to back. And yes, that makes sense to wipe front to back, but many, many people wipe back to front and don't get UTIs. So I think ultimately it's really not a hygiene issue for the large majority of people. In fact, my recurrent UTI patients are the cleanest patients I know. In fact, they clean too much to the point where they can create irritation on their skin, which can then mimic UTI symptoms. So clean normally, don't douche, don't put anything in the vagina, just use soap and water on the outside and let soapy water run down, and always use a sensitive soap, and really that's all you need.
All right, so stay hydrated, take care of that constipation, no hovering. Cranberry helps, huh?
Yeah, and make sure you're emptying your bladder. Yep. If you want to check out the rest of this AMA, make sure to check out our membership at rinamalik.supercast.com so you, one, can see full-length episodes of the AMAs as well as Ask Me Anything and get access to ad-free episodes and early releases of episodes with the transcripts on Supercast. And as always, remember to take care of yourself because you're worth it.